Yeah, recently the DPDPA Act has come and it is in the public domain for the comments. Okay, I am really looking after this one because earlier it was the personal data protection bills, but it has been renamed to the DPDPA. Before that, there is another act it has come for the healthcare that is called DISA. Okay, but DISA has come as an act and public opinion has been taken, but it has not been yet implemented. So what we have heard that the personal data protection bill was pending, so they are waiting for that, so that if any things is being approved, it can be incorporated in the DISA. Okay, that's why it is. We are looking towards it. We are really looking towards the DPDP because right now the sensitivity of the patient data is more vulnerable. What the study is saying that any data, if you talk about any domains across the whole industry, healthcare is more vulnerable. Okay, and if you talk about any hackers to hack a bank account, now it is in $3 to $4 you will get it from US. But if you talk about in healthcare, it is more than $30 to $40 to $300. It depends on the situation to situation. So this is the main vulnerability in the healthcare, and if you see the surcharge of the attack in healthcare, it has much more than any other domains. So one has to be very careful to safeguard their data as well as compliance. So in India, recently it has been coming up, yet it has not been implemented. It will take a few months to do it, but of course, we are looking towards the DPDP, what it is there to compliance to our healthcare. See, right now the draft, where it is the public domain for the comments. Okay, healthcare is a different domain than as compared to the other domains. Okay, it is totally different. We are very cautious about the privacy, security, confidentiality. All three components are very serious thing. And in healthcare, if you want to make a compliance, it's supposed to be practical. Because you see simple things I am talking about it. If the treating doctor, he can see the patient records. Non-treating doctor is not allowed to see the patient's record. If required, that the concerned treating doctor is not available, some other doctor has to see it, then he needs another things has to be given that he can assess their records. So and you need a consent from the patient also, that we are changing the doctors and are you ready to show your records to that? And it takes time. So practically, if you look into these conditions, it is very difficult to implement in healthcare. It may be in other domains, but when you talk about this privacy and security and confidentiality, DPDP, whatever it is there, as it is just impossible to put it in the healthcare. But still, we are closely working on it, and what best possible, whatever it is possible, we are on the process to implement it. Yeah, we have a very large team. We have around more than 20 people in the cybersecurity. We have in the applications. You have hundreds of people are there in development. Another 40 people are there. So on average, it is around more than 300 people. They are working in this department. Yeah, healthcare is a different domain. Already I have told you, it is a very complex because this is a highly regarded, and in the society they have a good reputation. If you talk to a profession, it is medical. Okay, and when you enter it in IT and you work with them, then it is another domains and which penetrating the healthcare domains. So there is a lot of gap we have, but slowly when technology people have adopted it, they have also started accepting it. But thing is that when you talk about the cyber security and when adopted by the doctors, it is a lot of resistance are there, because if you put all the policy in one place, it is very difficult to work for them. and they are so busy, they are so occupied, and if we talk about that, you can't see this, you can't see this, you can't see it, then means you are putting the hand gloves with their hands, and they are unable to give a right kind of treatment to the patient in time. So that's why we have to find a middle of that how we can use the technology, use the advanced technology, and how we can sustain also. Sustainability is much more required. And when we talk about AI, AI is very powerful, very powerful, and we have to be more alert about this, that AI attacks are very fast, they are attacking it, and very fast they can demoralize. But AI has other power also. You can protect yourself also. Okay, so just like we have a blue team, we have a red teams, both are using AI, then you will work fine, you fight it, AI versus AI. It is very interesting, yeah. Yeah, but see, but today's days, if you sleep, that you are nowhere. Okay, and you know it, the cyber attackers, the hackers are more powerful tools and most updated tools they have. Okay, so you have to understand the what kind of vulnerability you have, how seriously you are handling it, and what are the new technology you have to adapt it. You need a exposure or knowledge. Okay, we do not have any certain program for training in regular basis. Of course, there is a lot of online seminars, online different courses are there. It has been encouraged to our staffs to go through it, and simultaneously we have inside the discussions, inside the seminars, presentations, all these things is going on. So this is the way we have adapted it. We do not have any concrete programs for that. For this year you have to teach this. No, it's not like that. But time to times we have our own training and presentations and discussions is going on. Yeah. Very much right, and we are looking towards it. And already also DPDPA has mentioned you have CDO supposed to be when this will be approved. This act will be approved. Definitely, we'll have to adapt someone. Okay, we do not have a trained person, but we have to hire a person to look after this job, and this is a very responsible job, and one supposed to be have. Earlier, people do not have the knowledge about the what is the data protections. Today, it is coming as an act, and you have to follow this act. So definitely, they have recommended for the CTO to organizations. Of course, we're supposed to have that one. Right now, we don't have, but in future, definitely we have. Yeah.